Alzheimer's is a serious condition that affects many, but Professor Philip G. Haydon of Tufts University has new hope. He recently came to Needham to present his research. Let's hear from the expert on how GLIA cure may help those in need.
On Monday, February 29th, a Northbridge assisted living community known as Avita of Needham hosted an informational session called A New Hope for Curing Alzheimer's Disease.
There are many different approaches being taken by researchers and biotech and pharma companies, and I'll talk about the particular hope that we're trying to deliver through research that started in my laboratory and we now have in clinical trials in Alzheimer's patients. The brain is composed of two general types of cells. 10% of our brain are the electrically active neurons that we hear everything about, but there's 90% that's hardly been studied, called glia. And glia means glue. That's what we used to think they were. And what we now realize is they're active and they do very important functions in the brain. There's a particular type of glial cell, I call them the trash collectors of the brain. And in Alzheimer's disease, they stop taking out the trash. So there's a toxic substance in the brain of Alzheimer's patients that's not being taken away. It's much like if you don't clean your kitchen and take your trash out, we know the consequences are drastic. The consequences for patients are drastic. And we have found a way to reactivate these glial cells to take out the garbage. We found a receptor that's just on these microglia, the trash collectors, and we found a chemical, when it stimulates that receptor, it sends a signal through the cell and it activates them to start the job again. I happened to be in a seminar listening to somebody talk about a totally different topic, and they mentioned that this receptor performs a particular function, and the light bulb went off. I phoned back to the laboratory and I said, try this experiment, and it worked. And so based on that, we continued to move the project along and have now developed new compounds to test whether it works in patients.
Tufts has already completed 2 trials to test primarily if their drug is safe. After success in this area, they will now test if the drug prevents memory decline. Unfortunately, we are still looking at 2023 as the earliest year for FDA approval.
It's a long process for many reasons. First, you have to determine safety, but then also to determine whether the drug is working, you have to provide the drug for a long time to actually see if it's preventing this slow cognitive decline.
For more information on this Alzheimer's research and the Tufts University spin-off company for this venture, you can visit gliacure.com. For the Needham Channel News, I'm Jillian Tedesca.